Hello, primary care physicians. I'm Dawn Sherry, Vice President of Clinical Services for Southern Healthcare Management.
And I am Dr. Gonzalez, Southern Healthcare Management's Corporate Medical Director. We would like to introduce you to our center telemedicine equipment and process to help you get started with the virtual bedside examinations for the patients you follow in our centers.
That's right, Dr. Gonzalez. With a few easy steps, we'll help you better understand how to download the Telehealth Solutions app for your computer, tablet, or any device that fully supports Google Chrome applications. We will walk you through the login process and explore the diagnostic tools that are available on the Telehealth kiosk.
We will also introduce to you Dr. Ghannam, the co-founder and president of Telehealth Solutions, a company that has pioneered our telemedicine program. We will dive into how his team of physicians can be your backup after hours, weekends, or even holidays, should you choose this option.
Dr. Ghannam will also provide an explanation on how our primary care physicians can bill for telemedicine examinations. So let's get started with a quick overview of our vision for this program and how we can all use the telehealth equipment to provide proactive examinations of your patients exhibiting early signs and symptoms of a possible change in condition.
Early communication with the center's clinical team can help minimize or even avoid stressful rehospitalizations or unnecessary visits to the hospital emergency departments. Proactive utilization of bedside examinations using the telemedicine Kiosk Tools, combined with a live communication with the center's nurse and patient, if possible, can be invaluable to the diagnosis and treatment interventions to keep the patients stable.
The telemedicine kiosk comes equipped with the following diagnostic tools designed to transmit live clinical information right to your device. The first of these tools we want to discuss is a digital stethoscope. Once you have connected with the nurse at the patient's bedside, you can direct the clinical team member to place the stethoscope to any area of concern to listen to breath sounds, heart rhythms, or any other part of the patient's body that you would like to listen to.
We also have a pulse oximeter connected to the device, and it will provide you with live data, including pulse rate and oxygen level, as you are examining your patient. As an additional key feature, the telemedicine kiosk also provides a high-definition camera that you can control. The camera function allows you to zoom in with exceptional quality on key areas of the patient's anatomy that you would like to visually examine.
This camera feature will allow clinicians to view skin abnormalities, wound beds, dressing applications, or other areas on the patient where a clear picture of the patient's condition is necessary to provide a diagnosis and treatment orders.
When the initial examination is complete, as the primary care physician, you can now make an informed physician note directly into point-click care, including medication and treatment orders for the center nurses to implement.
As an added benefit, our centers have OmniCells, which include many medications and IVs that our teams may administer quickly without waiting for a pharmacy delivery. Please check with your Center Director of Nursing to find out more about what types of medications are stored in the OmniCell and if you would like any additional items added to the inventory.
Early intervention can make a positive impact in the treatment plan for our residents. Our goal with telemedicine is to use it early and often to help keep your patients stable and safe.
We would like to review our process leading up to a telemedicine examination at the patient's bedside. As the patient is ready to be examined or treated by the center's clinician, small changes in the patient's condition would be noted by the nurse. If warranted, the nurse would place a call to share their findings, and if required, the primary care physician or clinician may direct the nurse to bring the telemedicine kiosk to the patient's bedside.
The center nurse will retrieve the telemedicine kiosk to the patient's room, set up the diagnostic tools, and turn on the unit. When the telemedicine kiosk is in standby mode, this allows you to use the Telehealth Solution application to log into the kiosk's waiting room, and the nurse will then grant you access to start receiving the live video and diagnostic information to start your bedside examination.
While we understand that not all telemedicine examinations will result in no rehospitalization, our hope is that by working together proactively, we will minimize and significantly reduce the risk of an unnecessary emergency department visit. After the bedside examination is over, the center nurse will communicate with you on treatments, medication changes, or additional prescribed interventions. However, some bedside examinations may result in the patient being transported to an acute care setting, either through 911 or a direct admission orchestrated by you. To help you connect, we will provide step-by-step instructions on how to find the Telehealth Solution application and walk you through the initial download and setup process later in this video. Our centers will also plan a test run of your ability to quickly connect to the telemedicine kiosk so that you may test the diagnostic tools and become acquainted with using this equipment.
That's right, Dawn. We want you and your team to feel comfortable using the telemedicine tools, an ability to prescribe new orders or treatments directly into point-click care during and after the examination. And like with any new process, practice makes perfection. I feel confident you will like the ease and simplicity of our telemedicine program.
We would now like to introduce you to Dr. Ghannam, who will provide additional information about the many uses of the telemedicine kiosk.
Hello, I'm Dr. Ghannam, co-founder and president of Telehealth Solution. I want to thank you today for watching and learning a little bit more about telehealth and the opportunity that has now been presented to your center. So one of the biggest questions has always been, do I get paid for such services? Now, secondary due to the 1135 waiver and the pandemic, telemedicine now is a billable service. So whether you're seeing your patient bedside or you're seeing them webside, those codes that you use to bill will be applicable. For those of my colleagues who are still on the fence, this is the way I view telemedicine. Of course, hands-on care is always the best possible care. But the beauty of something like this is, it's not a replacement of us. It is a bridge for us, meaning we can't be at 15 centers all at once, but what we can do is be able to be connected to our patients when they need us and be able to facilitate that care for them and not allow geography or time be a rate limiting factor. We're able to advance the level of care for patients to now that they literally have 24/7 capability of having eyes on them, whether it's with your clinical skill set or with my team's skill set, but we together are interwoven in being able to provide the best possible quality care for these folks and their families.
Thank you, Dr. Ghannam, for that insight. I'm sure we can all agree that there are many benefits to using telehealth bedside examinations. We look forward to your involvement as we continue meeting the clinical and psychosocial needs of our patients.
Our commitment to the care and treatment of the patients is a paramount focus for all Southern Healthcare Management Centers in Florida, Georgia, and North Carolina. We are so thankful for your partnership and dedication to provide quality care and services. For further information, please contact your facility's administrator or director of nursing.